Okay, I've tried to make this video like 10 times, and I'm trying not to be the nurse that cries on social media. And I want to tell you an example of like how hospice and palliative care nursing can be hard, because I constantly talk about how amazing it is, and there are moments when today, it can be really hard. So I was on call today. I'm off now, but I'm still sitting in my car like reeling and crying over the day, which is very, very rare. But every once in a while, you get to a patient's house where they clearly need assistance like right now, right away. But because you're a home care nurse, like you're going to their home, you're not bringing anything with you. A lot of times there's nothing for you to do in the moment. And if the patient doesn't want to go to the hospital as DNR, DNI, there's nothing you can do except for like try to order things as quick as possible and get them to the house as quick as possible. But the quickest you could do would be an hour, 2 hours maybe, to get them. Like for instance, this patient that I saw today needed a hospital bed, needed oxygen, needed morphine yesterday. I walked in. This is where I'm trying not to cry because, hold on. When you walk into a patient's house, they're clearly struggling to breathe. Although you can tell they've been living like that for some reason. Like the family is like, no, this is how they normally look. Like the patient actually can like talk to you barely, but they're like alert. They're not alert, but they're oriented. And being like, do you feel short of breath? And it's like, yes. Do you want help with that? Yes. They were denied oxygen before because their oxygen level was too high, so they couldn't get oxygen in the home. Anyway, I can order all the things, right? But it's still going to take a couple hours. So in the meantime, this person who clearly needs to be intubated, but they don't want to be, which I'm all for. I don't want someone to get intubated if they don't want to be intubated and they want to die a natural death. But if someone wants to die a natural death, I want to have medications there to help them with symptoms like shortness of breath. But sometimes you just can't get it there quick enough. And in the meantime, there is nothing for you to do. You can put their head of bed up. You can do air, do a fan. But like, he had no medication I could crush up and try to give to him. Nothing. And the patient died. Before we could get him anything. Oh, what? And on top of all that, the patient was so gracious during his whole fucking death, which happened like that, because sometimes it does. Meaning, like, he would intermittently, like, wake up and be like, thank you. And the family was so wonderful. And I just feel like this because I don't even like saying this because I'm not trying to scare anybody, but, like, it wasn't the best, He could have had things a lot more controlled, and it makes me even more like this because instead of panicking or everyone freaking out that like that wasn't happening, they were all like gracious as hell to me. And I just feel so bad. I mean, I know there's something I can do. He didn't want to go to the hospital. He didn't want to be intubated. I got medication there as soon as I could, and it wasn't soon enough. And then he died. And it's not like, he was going to die anyway. It's not like he died. He didn't die because I didn't get the things there quick enough. He just was going to die. But I just wish we could have given him oxygen and some morphine to relax him a little bit. And it just wasn't quick enough. And that's all. And it feels awful. And I feel sad. And yeah. So those are hard days. And I'm sure other healthcare workers can relate and have been through the same things. And it's just what we go through, and it's just hard sometimes. That's it. And I also feel bad about this too, because like now I'm on the internet crying about it. I don't know. I don't even know if I'm going to post this. It's like, what? I don't need you to feel sorry for me. I just want to show the reality of the situation sometimes. I don't know. Okay. I don't know what I'm doing.